How do antiemetics help lung cancer nausea and vomiting? When facing lung cancer treatment, nausea and vomiting can be tough to handle. Antiemetics are medicines that help manage these symptoms, making treatment more tolerable. They work by blocking specific signals in the brain and gut that trigger nausea and vomiting, especially those caused by chemotherapy. This allows patients to focus more on their recovery and maintain their quality of life. Most lung cancer treatments involve chemotherapy drugs like platinum-based regimens, which are effective but often cause nausea and vomiting. These drugs stimulate the releases of chemicals such as serotonin and substance P. These chemicals activate receptors in the brain's vomiting center and in the gastrointestinal tract, leading to feelings of nausea and episodes of vomiting. Antiemetics target these pathways to prevent or reduce symptoms. For example, 5-HT3 receptor antagonists block serotonin receptors in the gut and brain, helping to control immediate or acute nausea and vomiting. Neurokinin 1 receptor antagonists, like aprepitant, block substance P, which is involved in delayed nausea and vomiting that can happen days after treatment. Corticosteroids such as dexamethasone are also used because they have anti-inflammatory effects and enhance the effectiveness of other antiemetics. Olanzapine, an antipsychotic, blocks multiple receptors including dopamine and serotonin, and is especially helpful in controlling nausea that persists or occurs later. Using these medicines together, often called combination therapy, provides the best chance of controlling both early and delayed nausea and vomiting. Typically, a 5-HT3 antagonist, an NK1 antagonist, and dexamethasone are given before chemotherapy. Sometimes, olanzapine is added to further improve symptom control, especially in treatments known to cause high levels of nausea. The benefit of this approach is significant. It reduces the severity and frequency of nausea and vomiting, which can otherwise interfere with treatment schedules. When symptoms are well managed, patients can better stick to their treatment plans and experience a better quality of life. It's also important to note that certain factors like being younger, female, having a history of motion sickness, or drinking alcohol regularly can increase the risk of nausea. Healthcare providers consider these factors when planning antiemetic treatment to tailor it to each patient's needs. Medical guidelines from leading health organizations recommend giving antiemetics before chemotherapy begins, rather than waiting for symptoms to appear. This preventive approach is more effective and helps patients avoid the distress of nausea and vomiting altogether. However, even with the best prevention, some patients may still experience breakthrough symptoms, which can often be managed with additional medications. In summary, antiemetics help lung cancer patients by blocking the biological signals that cause nausea and vomiting, especially those triggered by chemotherapy. Combining different types of antiemetics provides the most effective control, helping patients stay comfortable and continue their treatment with fewer interruptions. Always remember, it's essential to work closely with healthcare professionals to find the right antiemetic plan tailored to individual needs and treatment protocols.